Why is my frequent urination diagnosis delayed? If you have been experiencing frequent urges to urinate but your diagnosis has taken longer than expected, you're not alone. Many factors can make figuring out the cause of frequent urination a complex process. It often takes time because symptoms like these can stem from many different health issues. Healthcare providers need to carefully rule out other causes before confirming a diagnosis of conditions like overactive bladder or bladder dysfunction. Frequent urination can be caused by urinary tract infections, which are common and usually easy to treat, but they requiring proper testing like urine analysis to confirm. Other causes include neurological problems, such as nerve damage affecting bladder control, or structural issues like bladder or urinary tract abnormalities. Certain medications can also increase urination frequency as a side effect. Systemic conditions like diabetes or thyroid problems may also lead to increased urination, so doctors often order blood tests to check for these underlying issues. Getting an accurate diagnosis also depends heavily on detailed patient history. Doctors often ask patients to keep a bladder diary, noting how much fluid they drink, how often they urinate, and if they experience urgency or leakage. This record helps identify patterns and severity, but it takes time and patient cooperation to gather enough information. Physical examinations are also essential. These might include pelvic, abdominal, or neurological assessments to look for factors like pelvic organ prolapse or nerve impairments that could mimic or contribute to symptoms. Sometimes, overlapping health issues or previous surgeries can complicate the picture. For example, prior treatments like hysterectomy or neurological diseases such as multiple sclerosis can make diagnosis more challenging. Radiation therapy for cancer can also cause bladder irritation, leading to symptoms similar to overactive bladder. Because of these overlapping factors, healthcare providers may need to perform additional tests like ultrasound, cystoscopy, or urodynamic studies, which can extend the time to diagnosis. Another reason for delays is that some people might hesitate to seek medical help due to embarrassment or thinking that frequent urination is just a normal part of aging. This can lead to delays in reporting symptoms, which in turn delays diagnosis and treatment. It is important to remember that persistent frequent urination should always be evaluated thoroughly. It can sometimes be a sign of more serious conditions like bladder cancer, which may present with symptoms such as blood in the urine or ongoing urinary frequency. Early detection through urine tests or cystoscopy can be crucial for effective treatment. In summary, delays in diagnosing frequent urination often happen because doctors need to carefully exclude other causes, gather detailed symptom information, and consider overlapping health conditions. Patient delays in seeking care can also play a role. If you experience ongoing urinary symptoms, it is essential to consult a healthcare professional promptly. They can perform the necessary tests to identify the cause and develop an appropriate treatment plan, especially to rule out serious issues like bladder cancer. Remember, each person is unique, and a thorough, personalized approach is key to getting the right diagnosis and care.